A fading weapon in the HIV fight, condoms. Some HIV experts worry that the public health focus on prevention medication has accelerated a decline in condom use. Gay and bisexual men are using condoms less than ever, and the decline has been particularly steep among those who are young or Hispanic, according to a new study. The worrisome trend points to an urgent need for better prevention strategies as the nation struggles to beat the HIV epidemic, researchers said. Over the past decade, prevention medication known as PrEP has helped fuel a moderate drop in HIV rates. And yet, despite persistent public health campaigns promoting the drugs, they have not been adopted in substantial numbers by Black and Hispanic men who are gay or bisexual. The use of condoms, which prevent HIV as well as other sexually transmitted infections, has been declining across the board in recent years, not just among gay men, contributing to a rise in sexually transmitted infections. Researchers said that, with so much focus on PrEP, public health officials have overlooked condoms, contributing to the drop-off in their use. The goal of promoting PrEP is a valuable one, but it has overshadowed other prevention strategies like condoms, said Stephen Gaudreau, an HIV expert at the University of Washington. He led the new study and co-wrote a related editorial. A spokesman for the Centers for Disease Control and Prevention acknowledged declining condom use. But he said the agency continues to promote them. Local health departments that receive federal money for HIV prevention must include condom distribution in their strategies. For example, HIV rates have fallen in recent years, thanks in part to PrEP. But the decline in the United States, 12% from 2017 to 2021, according to government estimates, has trailed many other wealthy Western nations and even some hard-hit African countries. Gay and bisexual men are disproportionately affected. They make up just 2% of U.S. adults and 70% of new HIV cases. And infection rates are much higher in Black and Hispanic gay men than in white gay men. In 2012, pre-exposure prophylaxis, or PrEP, debuted amid landmark research showing that, when taken daily, antiretroviral drugs nearly eliminate the risk of contracting HIV. Within a few years, researchers established that people with successfully treated HIV could not transmit it through sex. These advances relaxed gay men's anxieties and likely hastened their abandonment of condoms, Dr. Gaudreau said. Public health agencies, clinics, nonprofits, and drug companies funneled hundreds of millions of dollars into promoting PrEP, contributing to its widespread use among white gay men. But the popularity of the drugs has remained relatively low among Black and Hispanic men, who are insured at lower rates and tend to harbor greater mistrust toward doctors. The new study of condom use, published Tuesday in the journal AIDS and Behavior, examined responses to a large online health survey of gay and bisexual men and teenagers from 2014 to 2019. About 10% of each year's respondents were drawn from the previous year's crop, allowing researchers to track changes over time. Among HIV-negative respondents, condoms were more popular than PrEP. In 2019, about half of participants said they used condoms inconsistently, and 17% reported consistent use. By contrast, just 12% of respondents reported having used PrEP recently. The investigators then looked at the 3/4 of respondents who were at the highest risk, those who were HIV-negative and hadn't recently used PrEP. In any given year, about 2/3 of these people said they had recently had sex without a condom. And among the subset of men who responded to consecutive surveys, the proportion reporting condom-less sex rose by 3% between their first and second years. The pattern was most striking among young Hispanic people ages 15 to 25, who saw a 19% increase in condom-less sex over just a year. Around the same period, HIV rates among Hispanic gay men increased by 3% per year, even as they leveled off among Black gay men and fell among white gay men, according to government estimates. Dr. Carlos Saldana, an infectious disease expert at the Emory University School of Medicine, said that public health leaders and schools are failing to address the sexual health needs of young Hispanic men, including migrants. When I came to Atlanta in 2020, there was zero messaging in Spanish and culturally sensitive messaging in sexual health related to Hispanic communities, he said. Only half of high schools provided LGBTQ-inclusive sex education in the 2019 to 2020 school year, according to the CDC. Since then, some Republicans have ramped up efforts to strip LGBTQ-related content from schools. Laren Nelson, an HIV researcher at Yale, noted one such law in Florida, which has a large Hispanic population and the nation's third highest rate of new HIV diagnoses. Florida community groups should fill the educational void to ensure at-risk youth learn about PrEP and condoms, Dr. Nelson said. We must find new ways to invigorate young folks' interest in condoms and to expand their accessibility, he said. The federal government, too, is neglecting to shore up condom use, Dr. Gaudreau said, noting that condoms are not mentioned in the official strategic plans for combating HIV issued by multiple health agencies.